Hello everybody, my name is Sarah Jane Marsh and I'm the Chief Executive of Birmingham Women's and Children's Hospitals. This is a fantastic opportunity for us to look back together over the last 12 months about all the things we've achieved together, as well as some of the challenges that we faced. And this year we're doing something ever so slightly differently. We're giving everybody out there, our patients, families and our staff, an opportunity to ask me questions directly. So, fire away.
Sarah Jane Marsh, I've got a good one to start you off. If you could describe this year in 5 words, what would they be?
Wow, what a great question. I would say busy, successful, challenging, exciting and special.
Sarah Jane, over the last year since we've been merged, can you tell me what you've done to bring the staff, the teams and the patient services together for the better?
So we've worked really hard this year to bring people physically together where we possibly can, to have some conversations about what they want the organisation to be about. But the big priority is creating that sense of community, knowing that we're all working to the same vision and values. And I really do start to get the sense that that feel of what BWC is all about is starting to run right across our trust wherever our staff are working.
So now that our new visions and values have been launched, how are you going to ensure that we truly live them in our day-to-day working lives?
Yeah, well, we're only going to live our vision and values if absolutely everybody in the organisation plays their part in that. In our staff engagement week, we asked everybody what the vision and values meant to them and how they were going to embed them in their teams. And I'm already starting to see that come to life now. There's people out there talking about ambition, about bravery, about compassion, and how we make sure that these things don't stay in a booklet or on a shelf. They're live every day in the way that we go about our work.
Sarah Jane, what was the staff survey results like this year?
Well, the staff survey for me is one of the most important things that we do in any year. And this year I was disappointed by some of the results that emerged from it. What I heard was that staff at the Children's Hospital feel pretty much the same way as they have in previous years, although they're finding the financial situation quite tough. But at the Women's Hospital, lots of our staff have found the integration very difficult and there is a massive sense of loss, and I feel there's more that needs to be done to support many of our teams at the Women's Hospital, and we've already listened and learnt from that. And in mental health services, I think we've let many of our staff down, and I think reading it hurt many of us a lot, but it was a massive wake-up call.
Sarah Jane, we had a lot of targets to hit this year. How did we do?
Yes, we did meet all of the national targets this year, even though it was really busy and really challenging at times. The emergency department standard, 18 weeks, cancer diagnostics, against the rest of an NHS that really struggled. We achieved that at Birmingham Women's and Children's, and that's because of our fantastic staff and the amazing energy and hard work that they put into making sure that our quality and access standards were achieved.
I have a question for you, Sarah Jane. Did we achieve the £19.5 million this year?
Yes, we also achieved our £19.5 million finance challenge, but it was tough. Again, it took lots of hard work from our teams right across the organisation, and I think we all have to accept that these challenging financial times are here to stay, and next year it's going to be difficult as well.
Hi Sarah Jane, I'm Lisa. Just wondering what sort of challenges that you might be facing over the next few months?
So whenever I'm asked a question about challenges, I always answer it in the same way. To me, the biggest challenge the NHS faces is about our workforce. We've got to recruit and retain the right people because our people are who we are. So lots of work going on across the organisation to make sure that we absolutely do those things, designing new roles. For example, we've got some fantastic nursing associates that have been working with us over the last year, but there's always more to do. But you know what? I always think the workforce are our biggest opportunity as well, and if we can get that right, we're going to get everything else right for the patients that we look after.
So wasn't Waterfall House supposed to be open by now?
Yeah. Waterfall House was supposed to have opened by now, and little did we know when we came up with the name that it was absolutely going to live up to it, because unfortunately we had a flood in there at the beginning of the year. Really disappointing because everybody really wanted to get in and start using the new facility, but we're back on track now and it's going to be opening in the summer, so great news.
Sarah Jane, I've got a bit of a harder question for you. It's been a tough year for forward-thinking Birmingham mental health service, hasn't it?
It's been a really tough year for everybody involved in our community mental health services. When we set up Forward Thinking Birmingham, we knew it was going to be a big challenge. It's a radically different model based on what our young people told us they wanted from a mental health service. But we massively underestimated how complex and difficult it was going to be, and we got lots of things wrong and we needed to have done better.
So Sarah Jane, what improvements have been made to the FTB since the CQC inspection?
So one of the big differences since the CQC inspection is we've been working with our staff out in the community hubs to really listen to their ideas for how we can improve the service. And by doing that, we are starting to see the green shoots of recovery, but there's still a massive long way to go. And we need to be realistic about what we can achieve in the timescales. But you know what? We're really determined. We set out on a journey because we're committed to mental health and we want to get this right for the young people in our city.
So what does the next 12 months and beyond look like?
Well, the next 12 months is going to be hugely challenging for the NHS. But at BWC, I really feel we're in a fantastic position to keep doing great things. And I think that for 3 reasons. Firstly, we have the most amazing, committed staff who come to work every day to do a brilliant job. Second, we have fantastic patients, our women, our children, our young people, our families. They want to get involved, help and support us to redesign our services, and they're massively inspiring. And the third is the general support we have across the city, region and beyond for what we do. Our fundraisers, our volunteers, we're part of a much greater family, and together we can make BWC the amazing organisation I know it is.
So my question is, how are the health plans looking in the local area?
So over the last 12 months, we've really come together as leaders in health and social care across Birmingham and Solihull to work out what better care we can provide to our patients and their families, not just for the next year, but for 5-10 years into the future. One of the things that we're most excited about is our maternity transformation programme, BUMP, which is looking at how we can give every woman and their family in Birmingham and Solihull a personal and safe maternity experience.
The research and development is very important for healthcare. I would like to know what plans we have for the next 12 months.
So research and development is one of the things that really defines a world-leading organisation. And whilst we have pockets of good practice, we know there are many areas where we could do better. Now, we've set ourselves some priorities for the year ahead and beyond, but one of our big challenges is our research culture. We need to get it ingrained that every patient who comes through our hospitals has an opportunity to take part in some sort of research, and that's going to be one of our key areas of focus as we move forward.
I've got a new boss.
I do have a new boss, yes, it's Professor Sir Bruce Keogh, and he's joined us from NHS England.
What's it like?
He's a doctor by background and he's massively passionate about women's and children's services and also our city and region. So we're really lucky to have him, but I also think he's going to be keeping me on my toes. Wow. Well, I really enjoyed answering those, and it gave me an opportunity just to look back over the year and think about all the fantastic things that we've achieved. And one of the things that I've noticed is that in all of them, they're all down to our staff. The amazing people who work at Birmingham Women's and Children's, who come every day to deliver great services to our patients. And we're going to keep going, not just next year, but for years to come, to make sure all of our women, our children, our young people and our families get the very best care that they absolutely deserve.